Finding problems, that's easy. They exist in every community. I'm Terry Springs, your host. We're looking deeper, and we are talking solutions, finding out how we all can make a difference. With us, Dr. Stephen Hansen with the Shepherd Eye Center. Thank you so much for joining us today on Talking Solutions.
Thank you for allowing me to be here.
I don't think I know anybody who doesn't deal with cataracts. Does that reflect on my age or what?
I don't know. Everybody gets cataracts sooner or later, so it's an issue that everybody should know about.
That's what I'm thinking. When I moved to town 23 years ago, that first summer and the intensity of the sunlight and how bright it is here, I started noticing some eyesight issues right away. And I didn't know if the intensity of the summer light here, can that make things worse?
Absolutely. UV light is one of the known causes of cataracts. It's one of many multifactorial issues that we talk about with eye disease, not only cataracts, but macular degeneration. But cataracts is one of the things that are more commonly known to patients, that the bright light causes glare. Glare causes difficulty driving. So that's one of the biggest issues. The first signs of cataracts is nighttime driving issues with the bright lights. But the bright sunlight obviously can really cause havoc with cataracts also.
I always wondered about that because I thought, was I just overly sensitive when I got here that first summer and went, wow, something's up. Dr. Stephen Hansen is with us today with the Shepherd Eye Center, and we are talking specifically about cataracts. How much of the population do you think deals with cataracts?
Everybody will get cataracts sooner or later if you live long enough. People don't really understand that cataract is something that is ubiquitous. Everybody will have either a family member or somebody to deal with that, and they think, oh, it's just an old person's disease, when you're 70, 80 years old. But that's not necessarily true. You can get cataracts at any age. Some children are born with cataracts and have a genetic predisposition to that, or have infections or things that give them cataracts early on. And so you have to take out the cataracts even in their infant stages to prevent amblyopia or lazy eye. And so from childhood up till, the time I've even operated on a patient that was 103 years old for cataracts. So there's a wide range of age, and I keep telling patients, it's not your age that makes a difference. It's your quality of life. When you start to lose your vision, you quickly realize that, boy, that's one of your most cherished senses that you have. And to not be able to do those things that you need or want to do really hampers your lifestyle. Yeah,
you have your taste and your smell and all these different senses, but the vision out of everything that you could possibly lose. I have gone over this in my own mind before. That would be the one sense that if I lost my vision, the independence is gone. I can no longer do so much on my own.
That's what everybody says. Do something else to me, but don't take my vision, and it's really sad when we do have patients that lose their vision for one reason or another, maybe bad glaucoma or trauma or other things. But the fun thing about cataracts is that it's a fixable condition. It's not necessarily a disease of the eye, but more like a condition that patients have where they get the lens of the eye that becomes cloudy and their vision becomes cloudy and they can't do the things that they want to do, whether it's reading, watching TV, driving, all those independent things that we take for granted that you start to lose because of the cloudiness of cataracts.
But it's not necessary to have to go through this vision loss.
Not with cataracts, because that's the one thing that we can fix. Cataract is the number one cause of blindness worldwide, because in third world countries, they don't have the ability to take care of it like we do here in the United States. In this country, it's lifestyle. As soon as you can't drive and you start having trouble reading the street signs, you're in seeing your eye doctor saying, boy, I just can't drive at night anymore. And so that's when we start taking out cataracts, when they're early on, rather than waiting until a patient is blind from cataracts.
Is that a tough surgery to do?
No, it's actually very high-tech and very easy on the patient. It is one of the most common surgeries in the United States. We have 3.5 million cataracts done every year here in the United States. And the success rate is very high, 98, 99% success. There's always that 1 or 2%. You can't give a guarantee that there may be an infection or a bleed or the implant that comes out of position or something, some complication. It's all in that 1%. But truthfully, 99%, you can't beat that as far as the odds.
No doubt. With cataracts, what are some of the symptoms, some of the signs that might lead me to my eye doctor? I know one of the things I've been talking about lately, everything is so small. What happened to the printing? It got really small.
Yeah, I think that's an age thing. Sorry. But
okay.
Everybody falls into that at a certain age. Usually over the age of 40, you start to lose your ability to read as the lens in your eyes. Maybe we should define cataract first and say that a cataract is the lens, the natural lens of your eye that becomes cloudy or dark and doesn't focus the light like it did when you were younger. It's not as elastic as it was, and so you lose your ability to read, you lose your ability to focus. The lights cause glare. People start having difficulty reading and seeing street signs, and with the bright lights, whether it's sunlight coming at the wrong angle or car lights coming at you, your vision deteriorates and you don't have the sharp clarity that you did when you were younger.
So this is not unusual. This is kind of something that happens to everybody?
Yes. Everybody, sooner or later. So you say, well, mostly it's an old person's disease, but it's not. There are celebrities that have cataracts. We know that Larry King has been public about his, Henry Winkler and Joan Rivers. But then there's people like Mila Kunis, who is only in her early 30s and had a cataract surgery. And you say, well, what happened to her? Well, it's not just age that causes cataracts. It's also other conditions that you may have, like diabetes or things like that. Mila Kunis had, I think it was reported in Cosmopolitan, that she had a condition of the eye called iritis. Do you know what arthritis is? Well, iritis is inflammation of the eye. So when you have a chronic iritis, it causes cataracts. And the medication that we use to treat the iritis causes cataract. So the cataract can be caused by medication or by a medical condition. And here she is in her early 30s having cataract surgery so that she could recover her vision in that eye.
I think of her as being quite young. I wouldn't have thought that someone of that age would require a cataract surgery.
We do see patients in their 30s, 40s, 50s. Most patients are because of age. Some patients have trauma. There's a lot of diabetics out there that get cataracts sooner than they would have otherwise because of their sugar levels going up and down and the fluid fluctuations in their eye and the lens. So the lens of the eye that becomes cloudy, we can't really reverse that. We don't have a laser. We don't have medication to reverse the cloudiness. The only real treatment is to take it out. And so surgical removal of the cataract, a lot of people believe it's just a growth over the eye, like a skin or some kind of mucous membrane or something that grows over the eye, and it's really not. The lens of the eye becomes cloudy, so we do a replacement where you take the cloudy lens out and you replace it with a nice clear lens implant. It's really exciting nowadays. I mean, we've got fantastic implants that we didn't have just a few years ago. You talked about not being able to read. When you do a cataract surgery, in the past we only had implants that focused one place, where you could only focus distance and you put the patients back in their glasses. They still had their astigmatism or curvature of the cornea, and you had to correct all of that with bifocals and with their regular glasses prescription. Nowadays, the technology has advanced so much, we have implants that have a built-in bifocal. So we can put a bifocal back inside your eye and not only return your distance vision, but your reading vision and your quality of life becomes so much better.
I kind of like that idea. I got those progressive no-line bifocals. You can do that with the lens in my eye now.
Exactly, and that's called a multifocal lens.
You can do a lot of stuff. Dr. Stephen Hansen is with us today from the Shepherd Eye Center. Cataracts are a big issue of discussion this month. We're trying to raise awareness. We're finding out that pretty much everyone deals with cataracts at some stage of their life. If you live long enough, you're going to deal with it, but it's really nothing to fear, even though cataracts are the leading cause of blindness. So the main thing we need to do, Dr. Hansen, is take action and actually go see someone like yourself to find out what the state of our eyesight is.
Exactly. A general eye exam, whether it's an optometrist or an ophthalmologist, can do an eye exam and tell you what your prescription for your glasses is. You know, if you have a change in your prescription, as cataracts start to cloud your vision, you can initially just change the prescription in your glasses oftentimes and improve your vision. So as long as we can improve things with glasses, we don't do surgery. Surgery becomes kind of the last resort. When you can't do anything else, then surgery certainly makes sense, and we can take the small risk that it is to go inside your eye, take out the cataract, and replace it with a clear lens implant and restore that vision. Then glasses work better. And if you do the premium lenses, most things are covered by insurance, and insurance is fantastic now that we have insurance for most people. Cataracts can be fixed and covered with a nominal fee. In the past, we couldn't even offer patients options to upgrade to a multifocal lens, for example, or to fix their astigmatism or things like that. But nowadays, the government has allowed us to offer patients these premium lenses and correction of their astigmatism. We even have lasers that assist us in cataract surgery. So there's laser-assisted cataract surgery that you can opt for and get very accurate, very excellent results, and have a multifocal lens that gives you both distance and bifocal vision with no glasses.
Dr. Stephen Hansen is with us. Are you actually performing some of these cataract surgeries that we're talking about?
Absolutely.
How many do you do a year?
Well, I've been here for 23 years, and I do over 1,000 cases a year. So I've done thousands of cases and have a lot of experience in cataract surgery and corneal transplants. So that's what I've done over the last 23 years. At Shepherd Eye Center, we do more cataract surgery than anybody in Nevada. So that's kind of our real exciting area that we love to do, because cataracts seem to be something that is, I kind of relate it to delivering babies, because everybody's happy with their cataract surgery. They come out and it's just a great experience. It was very easy for them to go through the surgery. The surgery only takes a few minutes, even though you have to be at the surgery center for a couple of hours. The surgery itself is very easy on the patient. We just give a little medicine to help them relax. Everybody's a little worried about doing something to your eye, and you're seeing what's happening and say, well, I can't stand anybody touching my eye or coming close to it. But with a little medicine to help them relax and a little instrument that holds their lids open, I tell patients, you're going to feel my hands at the side of your head and you're going to feel the eye drops that numb your eye, but there's really no pain. And just 10 minutes later, we're done with the surgery. There's no shot, no stitch, no patch kind of surgery. So it makes it very comfortable for the patients.
And they can remember after the fact because they're actually awake.
They're
not
awake.
Put out. They're just relaxed and sedated enough to where they don't react to it.
That's right.
It's okay. It just takes a minute or two. But after the fact, I'm sure that they can go back in their mind and relive that, yeah, I was there for that. I remember what happened.
We talk to the patients and we call it a vocal local, where you just make the patient very comfortable talking them through the surgery. And they feel the eye drops, and of course they feel your hands on the side of their head and things, but the surgery itself, there's no pain. The cataract has no pain. There's no nerve fibers there for them to feel anything. And it's actually a bloodless surgery, meaning we do a clear corneal incision, and the cataract has no blood vessels. We can do the entire procedure without a drop of blood loss. So it makes it very easy on them and easy on us. Patients get up and they go, really? You're done? You're all done? I didn't feel anything. The worst part is taking the tape off of my face, and they can see right away. And it's very exciting.
So we should not be frightened of this option.
No, not at all.
I'm thinking, too, we're talking with Dr. Stephen Hansen from the Shepherd Eye Center about cataracts. Big deal. This is the top cause of blindness. And once your vision is gone, am I right? It's not coming back.
No, as far as cataracts go?
If cataracts cause blindness
it's a
you.
fixable condition, though.
It is?
Cataracts don't come back. So once you've taken the cataract out, it is fixed as far as that goes. Let me explain a little bit about cataract surgery and what we actually do. So I said it was not just a film over the eye that we're scraping off, but it's an actual surgery. So it's important that you do it in an approved surgery center and with the surgeons that are qualified to do it. We make a small incision, we go inside the eye, and we have to remove the cloudy lens. A cataract, being the lens of your eye, has a membrane skin around it. So I tell people it's kind of like a grape, where you have a skin on a grape.
Okay.
You know how you can peel the skin on a grape?
Sure.
We peel a hole in the front part of that cataract. We clean out the entire cloudiness or cataract material, but we leave the membrane skin. So now we have a sac that's right where the cataract used to be. We roll up the new lens implants, which are made of either silicone or the newer acrylic plastic lenses that are really highly polished and smooth. We can inject those through that small incision inside the eye. They open up, and we position them inside that capsular sac. And that sac then contracts around the implant and secures it in place. So it's right centered behind the pupil, right where the old cataract was, but instead of being a cloudy material, it's a highly polished lens that's calculated specifically for each patient or each eye. We shoot for 20/20 and try to get them as close to 20/20 as possible with no glasses.
Wow. I would imagine that you hear that a lot when you describe this to somebody. They say, just like I did, wow. You've got to have on some kind of big magnifying kind of lenses, because it sounds to me like all the parts involved in this cataract surgery, the lenses, everything that you're working with, are so tiny. This is not big-scale surgery.
No, this is not like abdominal surgery where the instruments are 12 inches long or something. We have very small instruments that we use under a microscope. So microscopic surgery where we can see highly magnified images of the eye, and we look right down inside your eye through the cornea, so we know exactly what we're doing to make that little opening in the capsule, to clean out the cataract, polish it up, and inject that small implant through a small incision. So it's all microsurgery. That's what's so exciting, is that we can do all this nowadays, where, before, when I started all this so many years ago, the patients would come back the next day and you could easily tell which eye we had operated on because they looked like they had been mugged. They had red eye and they'd had a patch on their eye overnight and things like that. Nowadays, with the no shot, no stitch, no patch surgery, they come back the next day. The first night they have a little scratchiness, kind of like they have a lash in their eye or something. After a good night's rest, the next day they wake up and they're amazed at how bright things are, how clear their vision is. Everybody raves about the color change, because you take out a brown, cloudy cataract and put in a nice clear lens. The colors are then true colors. They say white is that pure white, like the new LED lights, that are almost blue. They're so bright compared to the soft white lights that are that yellowish color. And they can immediately tell the difference between one eye and the other, which is the color change. And it's pretty amazing, the wow factor that they get from the next day surgery.
It really ups the intensity of the colors that you're seeing.
True colors.
For real. Today on Talking Solutions, we've got Dr. Stephen Hansen with the Shepherd Eye Center. You guys do more of these cataract surgeries in Nevada, you said, than anybody else.
Than anybody else, yes.
And you've done thousands.
Yes.
And the technology is coming along. So for someone who's listening to us today and they are realizing that just about everybody deals with cataracts at some point in time in their life, it's something you will encounter. It's nothing to fear. However, it's really important for preserving your eyesight, taking good care of your eyesight, to do something about this.
But starts off slowly, and people don't recognize they're really having problems until they get to the point that they can't really drive at night as well, or they have more difficulty reading. And so it gets worse and worse with time. Some people change within 6 months or a year. But the most common thing that we see is that patients change slowly over time. So you may go 5 years, 10 years, or longer and not have much change. So as long as we can stay up with your good vision to keep you as close to 20/20 as possible, then we just change your glasses. If you get to a point where we cannot change your glasses and there's a need for you to have better vision, then the only other option would be cataract surgery. And that's what we offer our patients, is the opportunity to return to that 20/20 vision and ability to improve their quality of life.
And still nothing to fear. And you're saying to me also, Dr. Hansen, that a lot of people now these days, as far as the insurance status, is such that insurance companies are saying, yep, we're going to cover that. It's not going to be a problem.
It's a medical condition. It's covered by insurance. So you shouldn't be afraid of having cataract surgery. A lot of people put it off because they say, oh no, I can't touch my eyes. I'm so nervous about that. But we've made it so easy on the patients to come in and have a little medicine by vein or a little pill to help calm their nerves. And the surgery is only 10 to 15 minutes long. So if they go through the surgery without any complications or problems, they get up and they're seeing better right away. And there's really no reason to put off cataract surgery if it's affecting your quality of life.
What about the people who are just stubborn and just frightened? Probably deep down inside, that's what it really is. They're just not going to do it. I'm not going to deal with this. What are they risking if they don't do something about their cataracts?
We see patients that put it off and decide that it's just not for them for whatever reason. Perfectly all right. It's their eye. It's their choice. They can choose not to have cataract surgery. As they get older, it becomes bad enough that you can lose your depth perception if you have one eye that's not as good as the other. So stepping off of curbs, picking up your coffee cup, things like that become more problematic. We certainly don't want our older patients to fall and break a hip. That's usually the beginning of their demise.
That's the worst. You don't want to go there.
So there are some real issues, especially driving, and there's reasons to have better vision so that we don't cause accidents or get into difficulty in areas where we feel uncomfortable. But driving at night seems to be the first complaint that patients have. They don't feel comfortable driving at night, so their husband drives. They just give it to somebody else, or they don't go out as much, and so they find themselves staying at home more instead of being active and getting out and doing things like they should. That's what I'm talking about with quality of life and the ability to do those things that you want to do.
And this is a common scenario. According to the stats I'm seeing, more than 22 million Americans have cataracts.
Yeah, from what I've read, it's like 22 to 25 million over the age of 40 have cataracts. The most common age is 60 to 70 or 75-year-old that just with aging. But there's always patients that have been on medications for a long time for inflammatory conditions, for diabetes or other things. And all these medications have side effects, one of which can be cataracts and formation of cataracts. So we just encourage people, especially this month in Cataract Awareness Month, to get their eyes checked and have a professional tell them the state of their eyes and how they're doing. Even if you see 20/20, you don't know that you might have glaucoma. You don't know that you might have some retinal problem that needs attention. There's a lot of things that the eye doctor can find and tell you about. We can see diabetes inside your eyes. We can see very high blood pressure, hypertension. We can see changes from inflammatory conditions, glaucoma, other things. And so we give patients a complete evaluation, whether it's just cataract and glasses or if they need something else to control their pressure or inflammation inside their eyes so that they don't get the cataract as bad. So there's a lot of things that we can do and try to do it earlier rather than wait until the condition is so bad that we say, well, damage is done now. I can't really reverse that. We can go from here. We try to do things early.
But it doesn't have to be that way. It's easy to fix, right? What you would recommend, Dr. Hansen, for a person maybe who is noticing that they're having extreme difficulty driving at night, the glare of the lights, hard to read the street signs, things of that nature. If they are experiencing these kinds of symptoms, is the first step just to go make an appointment with the eye doctor so that you can start figuring out what's going on?
Yes, absolutely. You need an eye exam. It's hard for a doctor, even if you say, I'm having trouble, I can't do this or that. First thing he's going to say is, well, then you need to come into the office. Let us dilate your eyes, take a look on the outside as well as on the inside of your eye, and then we can do a full evaluation and tell you what you have, what the conditions are, what your options are. So when people hear that I'm an eye surgeon, they go, oh, well, you must do LASIK. Well, LASIK is a small percent of the business that we do. Very important thing for younger patients, and younger patients can improve their quality of life by having LASIK, getting out of their glasses and improving their ability to function without that crutch of glasses or contact lenses. On the other hand, cataract surgery is far and away more common, and glaucoma and diabetic exams and all the other conditions that we do far outweigh the number of patients that we do with LASIK.
LASIK, it sounds like, is a nice option.
That's right.
However, when we're talking about cataracts and the kind of surgery that might be involved, which is still very simple, very quick, very easy to do, painless, bloodless, all of that, that is the necessary element in so many cases.
I think it really improves society because it helps to keep people on the road. When they have bad vision, then we can fix that and they feel much more comfortable driving and they're safer on the roads. They help older patients so they don't fall and break a hip. They help everybody be able to take care of themselves without depending on their children or somebody else to do all that for them. They become much more independent, and that's what helps society.
Eyesight. Independence, that's what it means to me.
Even if you don't have the insurance that would cover all this, there are charities that help with this. We have the Lions Club and we have Sight for Life charity. There's Catholic charities and people that are willing to help people without insurance and without the necessary income to go through cataract surgery. We used to do Mission Cataract every year and do quite a few patients that didn't have insurance or income to really pay for it. Now with these charities, we have a little bit of ability to pay for the necessary goods and paper and the sheets and things that we use in surgery, so the cost of the surgery is kind of covered. We donate our time and our facility so that we can do those charities for people that can't afford it themselves. Two of my partners at this time, even this week, are down in Ecuador doing charity work for cataracts for patients down there that are unable to afford it. So we kind of go all over the world and try to help people recover their sight.
Vision is so priceless. We are talking cataracts, Cataract Awareness Month. Dr. Stephen Hansen with us with the Shepherd Eye Center. They do more of these cataract surgeries than anyone here in the state of Nevada. We're just suggesting that if somebody's having problems like maybe the driving at night, the reading of signs, things like that, get your eyes checked out and don't be fearful of any of the things to come. That's step one. We got to find out where you stand so that we can start to take positive actions to protect your vision.
That's exactly right. Last thing you want to lose is your vision and your independence. So get your eyes checked.
Dr. Stephen Hansen, I'm sure that we could communicate with you. The website would be a good place to go.
shepherdeye.com.
That's pretty easy. shepherdeye.com. All the links, everything, the interview, all of that on our Talking Solutions Facebook page. Thanks for all the information. We're glad you're with us today
Thank
on
you,
Talking
Terry.
Solutions.
It's been a pleasure.
Terry Springs here. I hope you can stay with us. We're going to talk about water in the desert. Doug Bennett is here with the Southern Nevada Water Authority. We'll talk with him after this.